I'm Geordan. I work across a number of, I wear a few hats, but I work on an exploratory incubator that tries to bridge the world of the health sector with that of Regen and Refi more generally. So I'm here on a bit of a limb because I'm a medical doctor by training. I work in health policy. I work with communities across the world, Peru, Kenya, Australia, Uganda, Sierra Leone, but then all the way up to working with the World Health Organization and within the UN system to achieve health change. We all talk about health, we all know qualitatively what it is, but it's an incredibly complex field, and often it gets boiled down to preventing disease. And there's so much more that we can learn from the regenerative movement, and in Refi in particular. So that's essentially the essence of my talk. So my journey was, as everyone's probably had, a complicated one to find Regen. But I would say that when I started my training as a medical doctor in the outback of Australia, there was an area that I worked with called Arnhem Land. It's twice the size of Switzerland, so it's huge. And it's a cultural, spiritual, and ecological preservation zone, which is run and owned by the indigenous people, the Yolngu people. And there's a sort of earth magic. Their worldview is very much embedded in the earth. And I guess that's where I first tasted the magic of what could be done for health through regenerative practice. Since then, I've worked with communities doing amazing things, but in often very extreme or limited settings. And they were intuitively putting in a regenerative approach to their practice, particularly with COVID. So in the Sacred Valley of Peru, in the breadbasket of Kenya, in the central highlands there, I mean, these food supply chains that they were depending on were so fragile and so fractious that during COVID, everything completely broke down. And so people were putting into practice this essentially regenerative approach. And I was really inspired by that and started to look for different ways to take that to scale. And so came across Regen practice, Refi, and the blockchain more generally. And I was highly skeptical of it because I'd seen techno-solutionism in health at large, so big pharma, big tech, big data, etc., and health. So I was finally convinced, though, by thinking about the principles of blockchain and what they could do. So decentralization, transparency, democracy, and security. And it's from that we started to look into Refi more generally and its applications to health. So that's really the focus of this talk in a nutshell. But I want to start to come back to the concept of health, because I think everyone in the room probably has different ways to express it. And I wanted to sort of start with that question for everyone. What does health mean for you? So that's, the microphone is here. I think we all have to speak into it so it can be recorded. But I'd like to just sort of pass the baton to you and just ask you what you think of when you think of health.
I mean, it could be life or death, but also quality of life. That's what it rhymes with.
Yep. So not just survival, beyond survival, but quality. Absolutely. Yeah.
I would say mental as well as physiological well-being, where well-being is not something that you can define for everyone, because I think it's also not at least in for everything. I mean, like of course some medical measures apply for everyone, but I guess also there are some variations individually and also maybe culturally for what that could mean.
So mental, cultural, as well as physical.
Yeah.
Absolutely.
Yeah, I just realized that it's not easy to to find words for health. I would maybe say that it's a state and maybe a set of some parameters within which system is working well and it is sustainable and it brings the results that we want to see. Yeah, and it's not harming.
Yeah, I guess within health, there are some meta skills there. Like as one develops a sense of awareness of like, this is what an insulin response feels like to food, or this is knowing how your brain works. You start building these like mental maps of meaning that help you better navigate your own health. So like at a higher level, I think like that's, I don't know, it's like meta healthiness, but like when you can actually have that conversation with yourself.
Self-knowledge as well.
Yeah, it's a massive part.
The first thing that I thought about was the absence of sickness, but I think it goes beyond that. And I think it's also very related to prevention and how can we live to our fullest capacity. And that will help me for me.
Yeah, that's really beautiful. I mean, would you like to have a crack?
Yeah, just to build off of that last response, I think it's like to me, I think of the word foundation. It's like health is almost a foundational requirement that if that breaks, you need to prioritize it. But if you have it, then you can build from there, and it allows you to build towards a life of meaning, I think.
I mean, that's huge. Thank you so much. You've put it back there for now. So all of these are health, all of these perspectives, absolutely. And I think health can be seen as this meta capability. And I think that's what you're describing. It can unlock the potential for you to live your life the way you want it. And a lot of people don't think of it as that, and they often think of it as the absence of disease, but it is about thriving, and it's holistic as well. In the health sector, however, we have this really rich conceptualization of health. The WHO, the World Health Organization, in its constitution, in 1948 or 1946, developed this very holistic vision of health being mental, physical, spiritual well-being. But actually, the way it's operationalized is very limited, and often it gets done through health systems, which is disease prevention, and it only scratches the surface of actually all of the factors that are driving ill health or good health in the world. And so, a lot of the policy that we work on tries to kind of create public goods for health, which are about health environments rather than disease prevention. So anyway, moving on to Refi. So I'm not sure, you probably all know more about Refi collectively in this room. A lot of people from blockchain communities, and I'm not. But my understanding of Refi is that it's Web3 for social good, the good of people and the planet. And in general, I would characterize the space as being very focused on the planet. Some emerging really good things are happening in social impact, but there's a lot of focus on the environment. And it's slowly changing. But I think if you get back to the fundamental principles of what is Refi, you can think about regenerative economics more generally. So just a sense check, has anyone done much regen economics in the room? So a lot of Refi projects in Web3 are based on the foundational principles of regenerative economics, and that in turn was built out of regenerative agricultural movements, which are inspired by indigenous knowledge and land practices. And so it's about creating economies that work for people and the planet, that do more than simply prevent harm, but they create good. They regenerate and they become self-sustaining and resilient. And so there's a lot of principles that relate to that around complexity, around autonomy, around sovereignty, around thriving, around relationship and scale. And if you were to take the practice of the health community and its objectives, and if you were to map it onto the Refi and regen space more generally, the Venn diagram would be highly, highly overlapped. However, what I'm saying, and that was a really exciting sort of realization, because knowing that we were working towards the same overall objective, holistic well-being, is incredibly exciting. But the tools and the lexicon were incredibly different. So a lot of what we're trying to do at the moment is to sort of cross-map these concepts from the health sector across to the regen Refi space and vice versa. So just breaking down what the health sector kind of looks like, at least from my perspective, you've got individual level, and you can think of it as like an onion that builds up or an ecosystem that builds up. And so at the individual level, you might have well-being and wellness practice. Often that's systematized into a health system. But as I said, often the health system is oriented around disease prevention rather than health creation. At the population level, you have public health practice, which is looking at the health of collectives and patterns and epidemiological trends. Then you have things like global health, and that's kind of where I work. So global health is looking at global trends in health that affect us cross-border. So COVID being a classic example, migration, climate, and all of the health impacts on humans. But emerging out of this field is the practice of planetary health, and this is where the lens that I want to introduce to you today. So planetary health is an extension of global health, and it's centering health in the discussions, but focusing on the interrelationships between humans, animals, and our environment more generally, and how that ultimately our impact as human beings on the planet impacts the environment, impacts ecosystems, and that leads back to ill health across all of these levels. So planetary health takes this sort of regenerative essence, but centers health in it. And so, as I said, if you map the two concepts, they really align, but we do it differently. So what are the sort of areas that we could read across? So I want to just take 4 concepts that sort of Refi projects do pretty well and talk about them from a health perspective. And so one of the projects, one of the components of these projects that I've noted is that they deal with externalities. So externalities in an environmental sense might be that fossil fuel production and consumption creates emissions which then go on to cause air pollution, environmental damage, and climate change. And so Refi projects focus a lot on externalities. A classic example of a health externality is cigarette smoking. So I smoke a cigarette, you get sick from lung disease because you inhale my smoke. Now, the way in which we can deal with environmental externalities, there's generally 2 ways. There's the sort of emissions trading scheme for carbon, and there's tax or subsidy. So fiscal policy, removing subsidies or introducing tax to change behaviour. But if you think about it from a health perspective, the idea of trading an externality like illness or trading even cigarette credits, that sounds like preposterous, actually. It sounds ridiculous. And so we don't do that. We actually have to kind of think about alternative ways, and health taxes and fiscal policy is one of those ways. But the most interesting thing about externalities in health is not externalities at all, but internalities. It's the choices that we make to live a healthy life that then, or to not live a healthy life, that then impact us in the long run. So if I smoke cigarettes today, I end up with lung cancer in the future. And if I was at my deathbed, and if you were to say, I can give you something that will take this away, you'd take the pill, you'd take whatever it was that I'd offer. And so changing mindsets to sort of enable people to make that choice earlier in life is about the creation of healthy environments. And so that introduces the second sort of big focal area of Refi projects, which is public goods. And so we're really, really into public goods creation and health. So the idea of a public good is that it's something that everyone would like to use or to access, but that individually we can't create by ourselves. So an example is a health system in the health world. So I couldn't afford to individually do that, but collectively we can. So public goods has inherently this concept of scale and collectivity. And so a health system or health itself is a really good example of a public good. Now, unfortunately, though, things like health and education systems are continually being cut and undermined and underfunded. And that comes down to its devaluation in the current system and the current economic model. So the third point about Refi models is it's encouraging how you rethink value. So Refi has done some great things in nature-backed currencies and rethinking the value of ecological restoration and regeneration. Yet health is still kind of stuck in treating illness rather than unlocking the potential value of health. Back to the deathbed. It's a bit morbid, but the deathbed analogy is a good one. Like if I told you had a day to live, but I could take that away magically and give you 10 more years of healthy, quality, good life, what would you pay for that? What would you do for that? I mean, I'd do anything. I mean, within reason. And the challenge that we have is that health is seen as a sunk cost rather than one of the greatest investments that I think we can all make. And so realigning policies and activities around that. And then the final area of Refi projects that has come up is impact. So Refi projects do some great stuff on impact verification and thinking about how to measure and report and trade on impact. And often that gets done in the environmental realm. So it's really great. You can kind of report back on a degree of temperature change or trees planted. But when it comes to health, because of this very rich and elusive definition, it actually becomes very difficult to measure. We have some tools available to us, but it's more than just measuring life expectancy alone. It's about trying to capture these aspects of quality of life, is what you were saying, and so yeah, it's much broader, and I think we still need to sort of tap into qualitative and broader concepts of health than we currently do. So at scale, generally, life expectancy, quality, QALYs and DALYs we use a lot as measures. So these are looking at taking life expectancies, but then adjusting them for quality or for disability. They're not perfect tools, but they're a start. In terms of now kind of mapping back from the health system and the health service and the health sector to Refi projects, what can we bring here? I think one of the number one issues that I've sort of come across in the communities I've worked with is participation. I think we know it in the blockchain world that community is everything when it comes to building these types of projects, but ensuring meaningful participation and voice is enormously challenging, and something that I think we do well in health because we have this huge patient-led advocacy movement that we can absolutely harness and learn from. So pathways forward, just some things to think through from and I'm going to sort of open this as a question to the floor. But what can we think of when it comes to making regen projects better, infusing health, centering health rather than having health as a sort of as an outcome or as a secondary impact? What can we do to make it central? Firstly, care. What would centering care in these projects look like? So healthcare, we say it all the time. What does it mean? It means this dirty body-to-body caring work that happens, and it's 24/7 sometimes for people who live and breathe this. So what can we do in the regen space to reinfuse care? That's the question, and feel free to comment as and when. The second thing is, what would regenerative health look like? So we say regen, and we use that term, and we use health all the time. But what would regenerative health look like? Instead of just preventing disease, what about regenerating health? Healthy individuals, healthy communities, healthy groups. So it's just another discussion point to leave everyone with in terms of pathways forward. So I'll pass the mic over to the group.
Yeah, I've noticed within the Refi community, there's been more talk lately of looking at more critically at why we're doing what we're doing. We can say it's for the good of the world, but what are our internal business practices? How are we violent to ourselves at a psychological level? Are we working from a place of scarcity? Or are we really here to serve others? And I think the really successful protocols and projects do a good job of connecting people at that deeper level of their motivation, of that place of service. Yeah, that's all I got.
But I think that's perfect. It's like thinking about doing to yourself and reflecting on your own practice, and making that sort of healthy at scale. So it's treating yourself kindly, treating others kindly, and that leads to sort of a healthy effect, right? A healthy.
And it seems to be in the zeitgeist. After COVID, mental health, at least in the States, I'm seeing it's become a much more mainstream topic, and even big tech companies like SpaceX or Tesla are now really taking serious their employees' mental mental states. So I think it's in broad like a really positive. When I think about regeneration, so much of like these physical challenges that people run into, I think often come from like more of a deeper like psycho-spiritual place.
That's really beautiful.
Thinking about regenerative health, I think that it's probably something about to find a way how to make health recreating by its own without like outer interruptions. So yeah, like what would be the way, what can we bring to the system so it can regenerate by itself, or like at least maybe like the closer to 100%, or with minimal interruption from the outside. I think that this would be around that topic.
Yeah, so cellularly, you do that a lot, and sort of thinking about that patterning that already happens, but more at sort of an sort of human level rather than a cellular level. Absolutely, yeah.
I think from my perspective, what many Refi projects or like the whole region community maybe is really good at, or has like a huge, like very good vibe or potential, is also because of this like decentralization narrative. I think like to manage well participation, as you said, and and also kind of enabling, like some sort of an enabling function, right? Like that you not only motivate people to come on board, but also to become active, right? Like not just voting, but mostly contributing even, like get people on board. But I think there are also many, like from my perspective, many contradictions in like lots of projects or their approaches enshrined somehow because of it's still, or it often also has a very finance or capital focused imperative still to it, and so I think to manage to balance both is often, or like also to enable participation in a broader level, like to not just mirror power structures that already exist. I think that is still a challenge, and I wouldn't say that to endorse like these crypto financial models in any case is a good idea. And so so I think that is maybe something which like isn't talked about so much because it's taken as self-evident very often because of this very good community aspect, I guess, because that works very well, and I absolutely agree, and I guess that's why I'm here too. So because I really enjoy working with the people and talking and seeing all the great ideas, but I think like still inherently there might be some aspects like a high technical dependence as well, or financial dependence, which have to be balanced at least, I guess. So, and probably the same for health then, like if when health comes into it, like the same as in natural capital or something.
Yeah, I mean, there is such a concept as health capital, for sure. And I think people advocate for that all the time. And the idea is that health becomes wealth because, as you said, it underpins so much of what we do. And so it is completely flipping it on its head rather than saying that health, paying for health is a cost, is actually an investment. And I mean, that's still in that same financial model. But I think thinking about rethinking the value of health as the Refi community is rethinking the value of nature, I think it is going to be a really important way forward for at least my practice.
Yeah, absolutely. I agree. So it's just like the question whether it's enough to implement it on a on a level that actually still depends on like a lot of technology or capital that actually also supports a model that you want to get less dependent on maybe. And yeah, but I guess that's a longer story. So
Yes, we could solve
Not
it in our
gonna-
lifetime, so it would be good.
so we just pass it.
I'm very new to the concept of regen. It's my first conference here, so answering these questions a bit hard for me. But on the topic of participation, I feel like and managing participation there, even though not everyone wants to, even if not everyone wants to proactively participate in, let's say, health care, I feel like it's something that we all care about a lot. And for example, when you compare it to paying taxes, I think for most people, if not all people, one of the biggest reason why people would be happy to pay taxes is health. I think it's the main one. Yeah, okay, then you have like roads, infrastructure when you really think about it, but it's, I think for most people it's the health aspect. So there's also a natural willingness to, as a community, even if you're not proactively involved in it, to incentivize people to be, whether it's financially or through whatever means. But just an idea that popped.
Yeah, absolutely. So, taxes is one of the greatest ways that you can redistribute wealth and also fund projects that are for the common good. And so you see this type of logic that you're saying at scale in health, but often politics get in the way. But in the purest sense, that it is a huge investment at the national level. Yeah.
Okay, last question. So one of the unique opportunities I see in Refi and perhaps Web3 more broadly is to better account for externalized cost. We talk about this in ecology often, what's the real price of the carbon or the water pollution. And I've seen some insurance companies, be it like auto insurance that's tracking the speed of your car, or now with continuous glucose monitoring, stuff going mainstream. I'm curious, do you see any opportunities in that space for a better accounting for cost and having that make its way into insurance premiums and to, I guess, in some ways like tokenize positive impacts or at least some way monetarily value those?
Oh, huge opportunity, but huge risk, I think, because you create systems that are able to do that, and they often get captured, especially when it comes to insurance. So our fear, so we've been looking at different ways to read these models across. And one of the biggest barriers is that in a sort of insurance model, that automatically sort of goes back to individualizing your risk and penalizing you rather than incentivizing you. So it does come back to this type of incentive model, revaluation model, and also measurement model. So I think tokenizing health, there's huge potential, and I don't think we've got there. Like I think in the health blockchain space, from what I can see, you've got sort of things that make already good health systems in high income settings better, and you don't have sort of a more collective way to build these goods. And so I think there's this huge potential, but as I said, like massive risks.
Yeah,
and once
real
again, a
ethical
lifetime
dilemmas there.
conversation. Ethical dilemmas, for sure. Yeah. Okay, I think that was the last question. So thank you. Thank you everyone for coming. Really appreciate that.